Hi there, I'm Dr. Ranjit Bajwa of Buena Vista Optometry in Ventura, California. I want to talk to you today briefly about some common eye emergencies that we hear from patients that you should know about. One of the most common issues that we come across is flashing lights or floaters in your vision. If you're experiencing a sudden onset of flashes or floaters, we do recommend contacting your eye care professional to be seen to make sure it's not a major issue. It could be a couple of minor things such as common occurring floaters or ocular migraine, but the more concerning things for you in terms of your long-term health and vision is to rule out things such as a retinal detachment or potentially a macular hole. What we talk about when we talk about a retinal detachment is the tissue in the back of your eye that collects the light, kind of like the film in a camera. In the human eye is very, very thin. That thin tissue is at risk of being pulled off of the back surface of the eye just due to time or head injuries, slips, falls, motor vehicle accidents, anything that causes a jarring injury to the head. Also, unfortunately, just due to time. So when we talk about a recent onset of flashes or floaters that start to occur, it is definitely important to come in for a dilated eye exam to make sure that there's no signs of any changes to the health of the retina that might threaten your long-term vision. If you do start to experience these types of symptoms, it is certainly recommended not to just wait on it and see if it goes away, particularly if it's something that's been happening for 5 minutes or longer in the same location in the same eye. If you do experiencing any of those types of symptoms, please call your doctor and get in for a dilated eye exam. That way we can find out that it is nothing serious and we can make sure that your vision is good for the long term. If you have any additional questions, please feel free to send me a tweet on Twitter at Dr. Raj Baj, or you can always contact us on our website. I'm happy to answer any additional questions that you have about eye emergencies.